Just a short time ago, I spoke with CDC Director Dr. Rochelle Walensky, and I asked her, with nearly half of Americans fully vaccinated, why are all the nation's numbers going in the wrong direction?
You know, we had always said that this country is a very heterogeneous country. In areas that we had lots of high rates of vaccination, we have lower rates of disease. And this virus is an opportunist. It has gone to areas that have lower rates of vaccination. And it's also a more potent, more transmissible virus. So both of those together are summing up to high rates of disease in areas that have been less vaccinated.
Every day we hear about more and more people who have been fully vaccinated coming down with the infections. There have been some concerns that the CDC has not been more transparent on this issue. Is there anything you want to say to clear the air on these breakthrough cases?
I do want to articulate that we expected to see some breakthrough cases. No vaccine is 100%, and I think we should be really lucky to understand that this vaccine is working against severe disease, against hospitalizations, against deaths.
Dr. Walensky, how do we turn around this wave? What's the best case in getting better?
The most important thing, I think, to realize is if we unify as a country, we can turn this around in several weeks. I'm really heartened by the vaccination rates that are increasing dramatically in some areas of this country that have been hit the hardest. So really getting people vaccinated, but in the meantime, to put that mask back on.
Are you getting closer to a decision on booster shots, at least for those at higher risk?
So we are following numerous cohorts across the country, tens of thousands of people, healthcare workers, essential personnel, persons and patients living in long-term care facilities, to look for any signal of any immunity that might not be sustained, to confirm that our vaccines are working well. And as we follow that, we have not yet seen a signal that indicates that we need to act on boosters. But the moment we do, we will be ready.
And Doctor, when we talk about vaccination rates, we talk about the number of people who are at least partially vaccinated. Let's talk about that partial. If you only have one dose of Moderna or Pfizer, how are you going to stand up against this particular variant?
I think we need to shift our dialogue and talk about people who are fully vaccinated. Data have definitely shown that one dose of the Moderna or Pfizer vaccine is not enough to conquer the Delta variant in the way that we need it to work. And so right now I'm shifting my dialogue to talk about people who are fully vaccinated. If you've only gotten one dose, even if it was more than 3 or 4 weeks ago, go back for your second. So yes, get both doses.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.